incorporate into their daily program.
It's great. Thank you very much. So, a couple of things. I'm going to have Dr. Sandberg now share with us some of his surgical expertise and talk a little bit about some of the surgical options for those individuals who have urinary incontinence issues. And that actually gets me to a question from somebody listening in right now saying that he's now 4 years out from his radical prostatectomy and he still uses 3 pads per day. Is it too late for him to see any improvement? He's already had some pelvic physical therapy. So, before I go on to Dr. Sandberg, Dr. Schaffner, any more type of physical therapy you'd want to offer this patient?
I absolutely say yes, come and see us, because what I have found is not all therapists are alike. And so sometimes I will have patients who come in and maybe he got his pelvic floor physical therapy within that 12-week, when we really do not want to do an internal assessment. That rectal wall can be kind of thin. And so we don't do anything internally within that 12 weeks. And maybe he is not doing his pelvic floor contractions correctly. 4 years out, we don't have to worry about that so much. So we can do a little bit more of an intense, comprehensive evaluation to make sure that he is actually breathing correctly, contracting the muscles correctly, and then also what the surrounding tissues, obturator, internus, and all the other muscles around the hips and the abdomen are doing. So I don't think it's ever too late, just mostly because I don't know what he's had already.
There you go. And so, Dr. Sandberg, what are some of your thoughts if you were seeing this patient?
Yeah, absolutely. So I echo that sentiment wholeheartedly. So especially when I see a man and it's been a little bit of time. So first of all, no, it's not too late to have improvement with proper therapy. But a lot of guys too, when I counsel them on surgery, surgery is somewhat, permanent. I mean, with these treatments, we're implanting devices, which I'll talk about in a moment. And technically, yeah, you could go back and remove them, but for the most part, surgery, once you choose to do it, you can't really go back on it. And so I always encourage men to explore that option of physical therapy first, or in parallel with getting ready for potential surgery if their incontinence is severe enough, so that they can at least convince themselves, I've done everything I can. And maybe I've made some improvements, but I'm still not quite where I want to go. And if they're in that camp, then I talk to them about surgery. 3 pad per day leakage, for example, after 4 years, I mean, it's not a high volume of urinary incontinence, but it's enough that it can be distressing to a man still, and we're still wearing pads, obviously. The first surgical option for men with stress incontinence, particularly that affects guys after radical prostatectomy, would be implantation of a male sling. A male sling is a mesh device. It's basically a very thin strip of mesh that's placed beneath the urethra. So an incision is made in the perineum, the area right between the rectum and the scrotum. We dissect down to the urethra, and we do what's called mobilizing the urethra. We find it and we detach it a little bit from some of the attachments that it has in the pelvis, so that it can be a little bit more mobile. And then we implant a sling to help provide extra support. So it's almost like a hammock that sits underneath the urethra. We're able to tighten that sling in real time in the operating room to our desired tightness. And it essentially gives that man more resistance, more outlet resistance to prevent urinary leakage. This tends to be offered for guys with what we consider mild to low volume urinary leakage. And my general cutoff is about 3 pads per day. You may find other surgeons who would go as high as 4 or even 5, especially if they're convinced that, it's a light pad. Some men change their pads the first drop of urine that hits it, and other men will be completely soaked before they change it. So you have to get that history too. But that's one option. What's nice about it is that it's a single surgery that takes about 45 minutes to an hour. Patients can go home the same day, and it requires no extra effort on their part to urinate other than what they're typically are used to. The bladder feels like you got to pee, and you go pee. The alternative is an artificial urinary sphincter. And this is a device that has 3 components. It has one component that's a cuff that wraps around the urethra and provides pressure. That cuff is connected by a series of tubing. One set of tubing goes down to a pump that's in the scrotum that the men actually will feel once they're recovered through the skin of the scrotum, and have to press a button on that pump to actually open up the sphincter. So you can imagine, in a normal circumstance, the sphincter is like this around the urethra. They press a button and it moves fluid in that cuff out of the cuff and into a balloon, so that it then looks like that. And the balloon is the third component that's implanted in the lower abdomen. That balloon holds the fluid automatically once they press that button for about 60 to 90 seconds, allows them to pee, and then automatically that sphincter closes back down around the urethra, and that restores their continence. And that's really the gold standard surgical treatment for men who have higher volume incontinence, maybe wearing multiple Depends or adult diapers each day, have very little urinary control. And we've taken men routinely from 10 pads a day, 24 hours, even during sleep, they're leaking, to either being completely dry or maybe just wearing one light pad per day for safety in cases where they're super, super over physically active, where they might be prone to leakage in certain scenarios. That surgery takes about an hour to 90 minutes. I keep most of my patients overnight in the hospital one night, but some urologists will send them home the same day. But it takes about 6 weeks to fully recover before they can start using it. So we actually implant the device, we leave it deactivated, meaning they continue to leak while they're recovering from surgery. And then in an office visit 6 weeks later, we will activate it, and they come in leaking and they leave the office that day dry. And I've had men in my office crying because it's been such a life-changing moment for them. And so, if it's this distressing thing in your life, it can really be a game changer.
And the satisfaction rate from either the sling or the artificial urinary sphincter is quite high, isn't it?
Yeah, it's very high. It's greater than 90%, even greater than 95%, depending on the population you ask and how you phrase the questions. And I think that satisfaction rate is so high because the AUS artificial sphincter, for example, has been around for almost 4 decades.
Yeah.
And so it's reliable, it's proven. There are literally hundreds of thousands of these in men that have been implanted. And so the satisfaction rates are so high because it's a very, well documented procedure, a well practiced procedure, and one where we're not guessing. I mean,